Let's talk about the treatment of metastatic bone pain. What do you do? So I'll talk about the goals of treatment, the pharmacological treatment, surgical treatment, radiotherapy, chemotherapy, and hormonal treatment. Starting with the goals. As the patient has severe pain, the first goal is to control the pain. Oftentimes, the bone may fracture or may impinge on the structures. So the skeleton may become unstable. So one of the goals is maintenance of stability of the skeletal system. So stabilization, especially whenever there is involvement of the spine. Another aspect of treatment is tumor control. We want to control the tumor. We want to reduce the tumor bulk. And that's what we do with the chemotherapy, with hormone therapy, and improvement of the functional capacity or preservation and restoration of the functional capacity of the patient, improving mobility, improving different daily activities. So the first step of management is giving pharmacotherapy. And the main goal of pharmacotherapy is reduction of pain. So we initially start with paracetamol, then we start the weak opioids, and we can also give strong opioids. Along with those, we might try the adjuvants. Another important drug to give is bisphosphonates, and bisphosphonates help in three ways. First of all, it relieves the pain. It decreases the risk of fracture, and it also decreases hypercalcemia. So bisphosphonate reduces pain, reduces the risk of fracture, and reduces the hypercalcemia. So three ways of working this bisphosphonate drug is so important in management of any metastatic bone pain. The next step is surgery. When to do surgery? Whenever a patient has fracture, especially fracture of the vertebral column or a high risk of fracture, we might have to do a surgical intervention to stabilize the skeleton. Radiotherapy is another way to reduce the pain. So it reduces pain, and also it helps in local tumor control. Chemotherapy may be effective, especially in patients with breast cancer. And hormonal therapy may be given patients with breast cancer or prostate cancer. Those cancers are often hormone dependent. So those are the steps of management of metastatic bone pain. In summary, the goals are pain reduction, skeletal stabilization, control of tumor locally, and improvement of the functional capacity. The pharmacological treatments are paracetamol, opioids, and bisphosphonate. Surgical treatment, if the patient has fracture. Other treatment option includes radiotherapy, chemotherapy, and hormone therapy. Hormone therapy is especially for breast and prostate cancer, and chemotherapy is especially for breast cancer. That's all.